CBS 46 is your vaccine team. Huge news from Pfizer. Today, the company announcing its COVID vaccine works in children as young as 5. Pfizer studied a lower dose of its 2-dose vaccine in more than 2,200 kindergartners and elementary school-age children. They developed coronavirus-fighting antibody levels just as strong as teenagers and young adults. CBS's Mola Lenghi has more.
I think it's just been a really wonderful privilege, really, to contribute in this way. And so,
Dr. Richard Chung is an adolescent medicine specialist at Duke Health in Durham, North Carolina. Chung's youngest son, 8-year-old Joshua, took part in Pfizer's recently completed trials for children ages 5 to 11 years old.
I think that everybody should get vaccinated so that things can return back to normal.
Pfizer announced this morning that the trials Joshua took part in showed the vaccine was safe, well tolerated, and resulted in robust neutralizing antibody responses. Those positive results mean Pfizer will now send this data to regulatory agencies around the world, including the FDA and European Medicines Agency, for approval.
The FDA looks at this data and feels confident that it demonstrates that this vaccine is safe and effective for children 5 to 11. You could have a vaccine within a month to 6 weeks.
Former FDA Commissioner Dr. Scott Gottlieb is a member of Pfizer's board of directors.
Pfizer tested multiple doses to find the optimal dose that had the best compromise between reducing the number of vaccine-related side effects while still providing efficacy that's on par with what we saw in 16 to 25-year-olds.
The vaccine has already been approved by the FDA for use in children 12 and up. Dr. Chung's older son, Caleb, took part in those trials.
I wanted to participate in the trial in order to help motivate other kids to get the vaccine.
Pfizer's announcement comes at a pivotal time in the fight against COVID-19. The most recent American Academy of Pediatrics report showed the second highest number of childhood COVID cases for any week since the pandemic began. The spike in cases has been driven by the Delta variant, which has disproportionately affected the unvaccinated.
I'm really proud of them, seeing them kind of courageously take this step and to do so really enthusiastically. Has just been a remarkable experience, not just as a pediatrician, but certainly as a dad.
Now, we should note that 8-year-old Josh was not sure whether he received the placebo shot or the real vaccine. He told us his symptoms were not severe. Mola Lenghi, CBS News, New York.